Start. Hi, everybody. As you guys are coming in, we're going to give you a minute or so to come on into the room. If you would, in the chat, if you would like to say where you are watching from and how you're doing today. I'm in Indiana, near Louisville, Kentucky, and it has rained all day long, and it finally stopped. Let's see.
And I'm in Denver, Colorado, but I won't talk about how nice the weather is because I don't want you to feel bad, Anna.
We got Vermont and Washington. Okay. Oh, fall weather in Nebraska. That sounds amazing. I'm looking forward to some fall weather. Oh, Australia. Two from Australia. All righty. So while people keep coming in, we're going to go ahead and get started. So I'm Anna Williams. I am the Vice President of Clusterbusters. And I have with me Joe Stone, who is Secretary of Clusterbusters. And we are here today with two people from electroCore who would like to talk to us about vagus nerve stimulation. And it's one of the many things, they will get more into it, but it's one of the many things that we can put in our toolbox as people who experience cluster headache. And I'm really excited to be able to share a little bit more about it. I have a little bit of experience with gammaCore and vagus nerve stimulation myself. And so I'm really looking forward to hearing why it helps and all of that. So with that, I'm going to go ahead and hand it over to Nori.
Hi, everyone. My name is Dr. Norianne Ingram. I have a PhD in neuroscience, and I am currently a medical science liaison, which is kind of one of the clinical specialists with electroCore. So with that, I will request to share. And share. Presentation. We're in presentation mode. Thanks. Awesome. Well, thank you again for being here and having us. Today, we are going to talk about how gammaCore, non-invasive vagus nerve stimulator, can help provide relief for cluster headache. We'll go into some of the science, and then Lisa Martin, my colleague, will help walk us through some of the patient experience. So again, we will give you a little bit of background on the vagus nerve. I'm going to introduce you to gammaCore. We'll kind of review current treatment options, including gammaCore and others. Then we'll talk about specifically how gammaCore and non-invasive vagus nerve stimulation can help control cluster. Finally, patient experience and training, and then we want to leave a healthy portion of question and answer time for everybody here. So your vagus nerve is the 10th cranial nerve. It is the longest and most widely distributed cranial nerve in the body. I like to say that it starts at your brainstem and basically touches every single organ in your body down to the first section of your large intestines. If we look at the fibers in the vagus nerve, 80% of those fibers are considered sensory or afferent, meaning they bring information from the body to the brain. And 20% of those are efferent, which means it brings instructions from the brain to the body. If we look at the sensory information carried by the vagus nerve, a lot of it is kind of what's going on internally. So it includes information about internal pressures, pain, stretch, temperature, chemical compositions, and importantly, inflammation. So the vagus nerve is one of the biggest portions of the parasympathetic nervous system, which is part of your autonomic nervous system and helps balance the sympathetic nervous system. So your sympathetic nervous system really mediates your stress response, your fight or flight response, and your parasympathetic, meaning mostly your vagus nerve, really mediates your rest and digest responses. These autonomic functions really have a major role in controlling heart rate, blood pressure, respiration, digestion, and peristalsis, among other things. But these are the big ones that probably most of you are familiar with. When we develop chronic conditions in any of these systems, a lot of it can be linked to inflammation. So, one of the things the vagus nerve does is really control inflammation across these systems. Again, if we look a little deeper, the vagus nerve, as I said, touches basically everything in your body. So, for the central nervous system, it really helps to reduce nociception, which is the perception of pain, and increases glymphic flow, so removing waste products from the nervous system. In the cardiac system, it helps reduce heart rate and blood pressure. In the pulmonary system, it increases bronchodilation, or how open your lungs and your lung pathways may be. It has roles in the hepatic, which is your liver system, as well as gastrointestinal and your spleen. And it's really in the spleen where the vagus nerve affects systemic inflammation in your body. And the vagus nerve can actually help decrease chronic inflammation through signaling at your spleen. So that's a little bit of the science behind vagus nerve stimulation. And I'd like to introduce gammaCore to you. So gammaCore, you can see an image of the device here, is a non-invasive vagus nerve stimulator. It is a handheld device that is fully rechargeable and provides a gentle electrical stimulation to activate the vagus nerve when applied to your cervical region at your neck. The gammaCore is a drug-free solution, and it is safe and effective for headache pain in adults and adolescents, especially in our migraine indications. It's considered a personalized therapy where you administer sessions to yourself and you can choose the desired signal intensity. Lisa will get into this more in detail. Looking at our clearances, so this is things the FDA has recognized gammaCore being safe and effective as a treatment. gammaCore is approved for the acute and preventative treatment of migraine headaches in patients 12 and older. It is approved for acute and preventative treatment of cluster headaches, which is why we're here today, in adult patients. It is also approved for several other headache conditions which are related to cluster headache. These are the hemicrania continua and paroxysmal hemicrania in adults. In 2022, the FDA granted gammaCore breakthrough designation for PTSD symptoms as well. Quick safety information. As far as contraindications, the main contraindication for gammaCore is that it should not be used in individuals who have another active, that means they're producing or using electricity, implanted medical device. So this might be something like a pacemaker, and hearing aid, spinal stimulator. As far as safety and precautions, so not in contraindications, but things we ask providers and patients to look out for. We have warnings for patients with inactive metallic implants. So that might be something like an orthopedic screw or a metal plate, but something that's not using electricity. Safety and efficacy have not been evaluated in pregnant women, children younger than the age of 12, patients with significant cardiovascular diseases, or people who have had their vagus nerve removed or severed. Associated side effects with gammaCore. Typically, these are very mild. Most patients will experience tingling or a lip pull or twitch at the corner of their mouth that will end as soon as the stimulation has stopped. Other than that, I would say the most common side effect I hear reported is a little bit of skin discomfort or irritation at the application site, but very, very mild. Overall, gammaCore is tolerated really well across a variety of populations. So moving a little bit into the science, I probably don't need to tell you guys what a cluster headache is, but kind of going over the basics. A cluster headache causes sudden, intense pain on one side of the head, usually around the eye or temple, and typically they are very short compared to migraines. Probably not to a sufferer, but a typical cluster headache will last 15 minutes to 3 hours. And it's typically accompanied with autonomic symptoms, which look like tearing eyes, stuffy nose, maybe facial swelling or sweating, or an eyelid droop. And that's going to be on the same side as the headache pain. Most people are experiencing episodic cluster headaches, meaning that these occur in cycles, and a cycle can last typically 6 to 12 weeks. Cluster headache has earned the moniker the suicide headache due to the extreme pain and the mental distress that patients will endure. And it's often misdiagnosed because symptoms can be hard to describe, and not everybody's having an attack when they go to the doctor's office. So, what's actually happening to the body or in the body when a cluster headache happens? Well, there's going to be a specific area deep in the brain, the hypothalamus, that's going to get activated in some way. And this actually might be why sometimes attacks can follow a daily or seasonal pattern. The hypothalamus is known for being one of our internal body clocks. Once that area is activated, it'll then kind of cascade to the trigeminal nerve, which carries the pain signals in our head and face, which leads to that severe pain. The trigeminal pathways become hypersensitive and overactive, which again leads to the intensity and why they might feel like they're coming on very suddenly. There's also an activation of the autonomic nervous system, which causes those other symptoms, the red eyes, nasal congestion, droopy eyelid. So cluster headache treatments can kind of be separated into two different camps. So we're going to talk about acute treatments first. These abortive treatments, they really need to be able to stop the attack fast, since the headaches especially can be as short as 15 minutes. So a lot of fast acting options include oxygen therapy, especially high flow oxygen, triptans, but typically a sub-Q injection or a nasal spray. There's also lidocaine nasal spray, and then of course gammaCore, which is going to stimulate the vagus nerve through the skin. But again, these typically need to be non-oral routes. Oral medications take a lot longer to actually provide relief. So these options listed here are gonna work better and faster than a pill. Moving on to kind of the second camp, we're going to look at preventative and transitional therapies. And the goal of these therapies are to reduce future attacks. So these are going to give more of a short-term, transitional therapies give some short-term protection while you're waiting for the longer-term treatments to start working, because they can take some time to build up. So the preventative therapies should help lower the length, number, or intensity of a cluster cycle. And common options include calcium channel blockers, corticosteroids, CGRP blockers, nerve blocks, anti-seizure medications. And once again, gammaCore can be used both as a transitional and a preventative therapy in some places. So if we kind of think about those treatments that I've listed, we want to talk about the limiting factors. A lot of those are not FDA indicated, and only a few of them really have strong clinical or scientific researched evidence in cluster headache efficacy. The only two FDA approved treatments are gammaCore, which you saw on both lists, and galcanezumab, which is a CGRP blocker, and that is only approved for preventative use. Again, speed is critical, so all these treatments really need to work within that 15 minutes, and oral pills can be too slow to actually help, especially in an abortive method. Oxygen can work really well. However, carrying around an oxygen tank on the go anywhere you might be can be really difficult and cumbersome. Many of the medications that are available have a limited number of how often you can use them. They can actually start to induce headaches, so something called a medication overuse headache. On the preventative side, preventative meds take a while to build up in your body, and they can also require a taping off period. And it can also be difficult for individuals who experience episodic cluster headaches to switch on to their preventative medications because you don't always know when you're going to enter a cluster attack. So how do you know when to start your preventative medications? And then extra treatments may be needed as a new cluster cycle starts. So let's talk about why gammaCore should work for cluster headaches. Cluster headache involves that overactivation of pain pathways through the trigeminal nerve. And gammaCore, I'll show you data in a second, actually directly decreases pain signaling through the trigeminal-vascular system. We've talked about already a lot of many times that treatments need to provide very fast relief, and our studies show that gammaCore can provide pain relief in as little as 15 minutes. And a lot of times we'll see patients, almost instantly get relief with gammaCore or begin to. So the attacks, as I mentioned, are also accompanied by autonomic symptoms. So gammaCore signaling through the vagus nerve may help regulate the autonomic nervous system and regulate some of those symptoms. And so chronic cluster attack especially can involve multiple attacks per day. So if you have a limited amount of medications, you might not be able to cover all your attacks in a single day. And gammaCore can be used daily, multiple times a day, up to 24 times a day. We have safety data for, and it has been shown to reduce the number of weekly attacks in chronic cluster patients. And then again, many treatments have side effects or limitations. So gammaCore again is not a drug. It is well tolerated and can be used multiple times a day without actually interacting with other medications. So it can be used in conjunction. This was the data that I mentioned. So here on the right, you can see an image from fMRI study that takes slices through the brainstem of a healthy individual. Anything in orange you see is an upregulation of activity, and anything in blue is a downregulation. So the orange dots you can see here are the vagal sensory centers in the brainstem, which makes sense since that's where the vagus nerve brings information to. And if I can bring your attention all the way to the bottom slice, you'll see those little blue dots. That's the spinal trigeminal nucleus. So that is showing a decrease in activation in the centers that relay pain signaling for the head and neck. So I want to show you a little bit of data from our clinical studies using gammaCore to help treat cluster attacks. So this is from combined data from two different studies looking at gammaCore for acute treatment, and especially in episodic cluster patients. So these bars in the middle. You can see that more than twice as many had fast pain relief with gammaCore compared to sham. and pain relief started within 15 minutes and lasted for an hour or more. The attack intensity was also significantly decreased. So, this is the percentage of cluster attacks where patients achieved a pain free status. So, this is the orange is using gammaCore, and the gray is using a sham device or kind of like a fake signal. Um, so gammaCore works consistently across multiple attacks, and there were no serious side effects reported in either of these studies. So this next piece of data comes from a different study looking at gammaCore to help prevent chronic cluster headaches. So here in the data, you can see the gray now used gammaCore in conjunction with their current medications, and then the orange are just the current medications. So when gammaCore is added, patients saw almost 3 times fewer cluster attacks on average per week. So that's 6 fewer attacks on average per week. And 40% of patients using gammaCore had their attack frequency cut in half, and that can be compared to 8% who were on their standard treatments. In a follow-up analysis, they also pulled out this little tidbit of data that some patients with chronic cluster headache actually achieved 100% remission where they had no attacks during the study. So to kind of sum up some of this clinical data, gammaCore can provide rapid and sustained relief with 42% of patients achieving pain relief within 15 minutes and sustained relief after the reduction of pain. For the preventative slide, the patients experienced on average a 40% reduction in attack frequency and almost a 60% reduction of acute rescue medications. Additional advantages, there are no limit to daily treatments and no device-related adverse events. So with that, I'm going to end this section and I will hand it to Lisa unless Anna was going to jump in.
Do
That's
you
fine,
want-
Anna. If you want to go ahead and say a few words.
Sure, I'll say just a little bit. So I am a chronic cluster patient, and I was really struggling. My attacks were coming 2 to 4 times a day and lasting 2 to 2.5 hours each. And was struggling to find treatments, and I slowly did start finding a few treatments that were helping me, but I could not get my attacks to completely go away. And the constant shadow pain and always sitting on the edge of my seat waiting for the next attack became a really big burden on me because I didn't know when the next attack was coming. And as a single mom, I needed to take care of my kids. So that's when I found out about gammaCore and vagus nerve stimulation. And I thought, might as well give it a try. And so I added it to the treatments that I was already doing. And I had started getting significant relief with my treatments, but I just couldn't get them to stop. So I added gammaCore in, and I have not had a cluster attack since. And that was in March of 2021. But I did continue having shadows, and so I was using gammaCore on the shadows. And what I noticed was I had a regimen where, like they were talking about, a personalized experience. So what worked for me was I would do 3 stimulations 3 times a day. And first thing when I woke up, and then midday, and then before I would go to bed. And then if I had shadow pain, then I would do 3 more stimulations. And like they said, you can do 24 a day, but I was doing 9 to 12 every single day. And what I noticed was my nervous system was calming down. The PTSD was starting to calm down, and the shadows became less intense. And like I said, I never had another full-blown cluster attack. And looking back, I know that calming down my nervous system had a big part in finally getting them to stop, because I hadn't been able to do that before. And so, as a chronic cluster head, I found that I needed to pick a little bit out of each category to be able to get ahead of this. And I'm just really glad that vagus nerve stimulation exists and that I was able to add it and that it was helpful to me. And so, what I just want to tell everyone listening to this is keep trying things, keep trying to find things to add on, because if you have something working 40% and something else working 40%, and then you can find something to cover that 20% that you're missing, it's worth it. So with that, I will hand it back over to Lisa. And thank you, Lisa. And thank you,
Thank
Nori.
you. Yeah, thank you for sharing your story, Anna. I really appreciate hearing stories like yours. My name's Lisa Martin. I'm the VP of Customer Experience at electroCore. I'm also a nurse by background, and I spend most of my days listening to stories like Anna's, coaching cluster headache, migraine patients, headache patients in general, how to use gammaCore to best advantage. And a part of our program that I'm really proud of is that we kind of partner with our patients throughout their whole entire journey. Go ahead, Nori, if you want to forward to the next. Yeah, so this is what I'm talking about. We provide a white glove patient support program where when you do choose to give gammaCore a try, I have a whole team of people. We're going to reach out and send you tracking, let you know your device is on the way. We offer an encouraged, personalized one-on-one Zoom training with absolutely every single person who starts gammaCore. While it's not difficult, and I'll show you how to use it in a minute, it is important to make sure that you're set up for success, that you understand exactly how to use it, you're comfortable and confident, so that you can go into like day one, like Anna explained, knowing how to use it to best advantage. And then we'll check in with you about 3 to 4 weeks in, because we want to make sure that you are using it on a regular basis. Just like Anna said again, people who use it on a regular basis, we have heard it seems that they get the best results when they are using it on a regular basis. And then we'll let you know, when therapy is running low. Usually it's dispensed in 3-month increments. We're going to check in with you before that 3 months is up, just to see how you're doing and make sure you understand, how to extend your care if you want to go beyond the first 3 months. Go ahead, Nori. So again, training is essential to a success. This is like my theme song. Again, we offer personalized Zoom training. We'll answer all your questions. Even if you've tried it and it's going well, you can schedule a Zoom with us anytime to just have us answer questions or, walk you through stuff or re-walk you through stuff. Builds confidence, and makes sure that you have the best chance of getting good results. There's lots of questions that people ask. Common questions are, where do I position the device? How do I know how high to turn the intensity? How often should I use the device? And what should my expectations be? Those are all great questions. I would say 90% of our patients have, and they're good questions. So we can help answer some of those. Next, Nori. This slide is the basics. This will show you how to use gammaCore. Basically, it's as simple as 1, 2, 3. 1, you're going to find the treatment site, which is right in this jugular groove where you feel your pulse. You can use it on either side of the neck, so that's also a nice option. Typically, we recommend using it on the same side where you have pain. But if somebody, has a cut or something that would necessitate that they use it on the other side, you certainly can, because as Nori said too, those signals are mostly going apparently up to the brain, where the brain can then, the signal will cross over and the benefit will come down both sides. So it is okay to alternate sides, but most people, especially with cluster, I would say typically use it on the same side where they have the pain. Then it just requires, and I'll walk you through it real quick in case you haven't ever experienced. This is the gammaCore device. When you turn it on, I don't know if you're going to be able to see this on the screen, it will beep and there's a screen that lights up. You put a little dab of gel on each stimulation head. That conductive gel is just necessary to conduct the signal across the skin and into the neck. So I've turned it on, I've got my conductive gel. I know my target is right here in this jugular groove to the side of the windpipe, tucked up under the jaw. There's sort of a V-shaped groove here where it's widest under the jaw. So that's where I want to keep it tucked up under the jaw right there. There's also a bar along the side of the device. The very top dot of the top section of the bar, it's really tough to see on this video, will increase the intensity and the very bottom dot will decrease the intensity. So you have complete control of the device in the palm of your hand. So you're going to place it. It's at 0 intensity right now. All I feel is cold gel. And then as you see in number 3, you're going to slowly but consistently press the very top dot. It will beep each time that it increases in an intensity increment. And eventually you'll start to feel some tingling sensation. Everyone's different. Sometimes you feel it at push 2 or 3, sometimes not till 4, 5, or 6. But you're going to continue pushing that until you get a tingling right below the stimulation heads. And again, it starts out very gradually, but then you're going to continue increasing it until you get that sort of tingling feeling rising up into the lower part of your face. Some people even notice a slight tug at the corner of the mouth. And that's okay. That lets us know it's turned up high enough to actually activate your vagus nerve, but it should never be uncomfortable. That's why I recommend turning it up from 0 every single time you do a session, because that will ensure you have a very gentle experience and you're going to stop turning it up when you feel that deep tingling sensation. And then you just hold it in place at that level for the remainder of 2 minutes. Every single stimulation lasts for 2 minutes, and that includes the time it takes to raise the intensity. That usually takes most people 20 to 30 seconds, and then you leave it in place for the remainder of 90 seconds or so, and that is enough time to actually activate the vagus nerve to send that signal up to the brain. So after 2 minutes, and you can see I continue talking, you can get the hang of this and make a pot of coffee while you're doing your stimulation. So it really is an easy part, an easy thing that you can incorporate into your daily life. Doing it 3 times in the morning, 3 times at night. Our typical recommendation is 2 in the morning and 2 at night based on our studies. But just as Anna said, it's okay if you add more in because we know it's safe to deliver up to 24 a day. So it will take a little bit of practice to find out what's right for you. Because some people might find 2 is enough, others might find that 3 is better for them, and that's okay. So that's a nice part of that. It just beeped twice. My intensity was at a 19, so the intensity range on a gammaCore is 0 to 40. And about 85% of people turn it up somewhere between 15 to 25 is pretty average for most people. Of course, there's some people who get a deep tingling at 12, and that's okay. And others need to turn it up to 35, and that's okay. So just remember that more is not better. So a lot of people seem to think that more must be better, but actually that nerve is like a light switch. Once it's on, it's on. And if it's on at 19, there's no need to turn it up higher. It will just involve surrounding tissue more and make it unnecessarily uncomfortable. So we want it to always be comfortable and not painful. And then you just wipe the device off with just a tissue or a dry cloth, wipe the neck off, and then, it's ready to be. You can either do a second stimulation, takes about 5 seconds to reset, or once you're done with all of your stimulations, it would just turn itself off and you can put it aside. But I also recommend to take it with you where you go, because as Nori said, it is portable, and the earlier you treat, the better. So if you're out and about and you notice whatever your symptom is, if it's a shadow, something or other that oh, this is a cluster coming on, step aside, do your stimulations 2, 3 at a time. Hopefully within 15 minutes, you'll have some benefit. If you don't, you can do 3 more stimulations. That's also fine. So it gives you the flexibility to treat more or less depending on how your pain is in any particular day. I hope that makes sense. I always encourage people to take it with them because you want to be able to use it, actively and flexibly as your symptoms arise. Next, Nori. So the treatment protocols I already really went over. In the instructions for use, it's going to tell you to do preventively 2 stimulations in the morning and then again 2 stimulations at night. So that is sort of a baseline bare minimum that you want to get on board to help start calming your nervous system down. But then the acute treatment is if you have some symptoms, you want to treat at the earliest opportunity and do again 2 stimulations at the onset of pain. And then again, if needed on the same side of neck, like 15 or 20 minutes later, you could do another 2 stimulations. And then even 20 minutes later, you can do another 2 stimulations. So acute is flexible. You can kind of layer it on as needed. And again, the recommendation is 2 just based on our studies. But again, there's flexibility and it's not dangerous to do 3 if you need to. Next story. Treatment tips, I think I probably already went over some of these as well. Some patients will see immediate results. They'll do a stimulation and get an immediate acute result in 15 minutes. Their pain will dissipate. Others, it may take 4 to 6 weeks to see benefit. So if you don't see benefit for an acute attack, don't think it's not going to work for you. What we want you to do is continue to use it regularly for a good 4 to 6 weeks. And hopefully over that time, you'll start noticing maybe your clusters are less intense, they're less frequent, and they're not as painful. And eventually, hopefully, you're having less of them. Best results are seen with regular use. You can treat either side of the neck, we already went over. Keep it with you, we already went over. And it is safe to travel with, which is a good point. So some things are difficult to travel with, like oxygen, but with a gammaCore, you can just literally take the device, take a tube of gel, put it in just a little travel bag, a little zip up bag, and keep it in your carry-on. And then it goes right through TSA. You don't even have to take it out of your bag. I have traveled with mine many times, as I know Nori probably has too. Next. Real patients, real results. So these are some examples of the people that I talk to like on a daily basis. And like we just heard from Anna, I'll just read through them real quick. Anyone who has cluster headaches should have gammaCore. It could not be simpler to use. It eliminates the fear in your life that you have no control. gammaCore makes me feel like I have my life back. Love these stories. With gammaCore, I'm able to do so much more with my life. I can travel without worrying about dizziness, increase my hours to be full-time again, spend time with my family and friends, exercise regularly, and so much more. I also noticed I felt less anxious when I was using the device. It does help calm you down and help with stress. I have cluster headaches every day, and I know I can use gammaCore easily and discreetly several times a day and being included in activities with family and friends. No longer am I experiencing daily trauma and having my loved ones watching it. And I know so many stories I've heard is people just being so frustrated that they can't make plans because eventually, or inevitably, they end up canceling them because this disease can be so unpredictable. Next, I don't feel like I'm living in fear of when my next attack will happen. Although my next attack might knock me down temporarily, I'll be able to address it and get back to living life with minimal interruptions. gammaCore is convenient, easy, and quick, and it provides a much faster end to my symptoms. With gammaCore, I can live a more normal life. I can get off the drugs my doctor has prescribed to lessen the severity or reduce the frequency of cluster attacks. And also importantly, that reminds me, this can be used as an adjunct therapy. So if you're already on another treatment that, like Anna said, is helping you 40, 50%, and you feel like you just need a little bit more of something to layer on that might help you bring you to that next level of healing and wholeness, this can be layered on without having to stop your other treatments. Next, Nori. And that's all I have.
Thank you so much. And I really do recommend if you use gammaCore to reach out to the team because they're amazing. Lisa, I think you were one of the people that you may have even been the one to walk me through how to use it. And I love how patient you guys are and you answer the questions and you help us find what will work for us. And that really stood out to me. And I really like that you guys do that. So thank you so, so much. So we do have some questions. Nori, I think the first one would probably be best for you if you're able to answer it. For contraindications, you mentioned active implanted devices. What if a SCS, spinal uh, cord stimulator, I'm guessing, is turned off or in MRI mode?
I'm muted. So technically it's still a contraindication, but you should talk to your provider about it. And I know a lot of providers will feel okay about that, but that's definitely a decision that you want to, a conversation to have with your provider and make that together with them.
Thank you. So our episodics out there, they don't always know when their cycle is going to start. So how would they go about gammaCore? Do they order it ahead of time? Can you explain how the ordering process works so that people know how to have it on hand and how all of that works?
Right. I can answer that one. I've answered this a lot of times. So, as I mentioned, gammaCore is dispensed in 3-month increments because it is best once you do start using it to use it consistently for 3 months. So, if you are only going to use it episodically or acutely, you can order it. You can have it in your home, but we recommend that you do not turn it on because once you turn it on and turn the intensity up past 3, that starts that 3-month time period. And whether you use it or not, that time period is going to elapse. And then you don't want it to be empty when a cluster headache happens. So what we can do is you can order it. You can schedule training. We can train you through all the steps, but without actually turning it on so that you can reserve that device to turn it on when you actually need it. It is a little tricky because, of course, I would prefer you to have a stimulation and try one actively with us to make sure you're comfortable and confident, but that is an option. You can hold it and then use it when you need it. But as we've seen and discussed already, people do tend to get really good results if they use it every day. And so if you do get it and you do use it preventively every day, even if you're not in a bout, say you're every 6 months like clockwork. If you start using it even when you're not having headaches and you're using it 2 in the morning and 2 at night, you might find your bout doesn't start like clockwork anymore by the time you get to your 6-month mark. So hard to tell. I mean, we have people who do both. I have people who do treat every day, and I have people who hold it and reserve it and only use it acutely. So option is there for you to do either.
And I really like that too, because the point of that you're saying is, once you start using it, the clock ticks, right? So you might as well use it every day to have that preventive going. So once you activate that card, making sure you get into those daily habits can be really helpful because it does tick down the day whether you use it that day or not.
And I do get that question frequently too. Why is it like that? And the reason is because it is a prescriptive device. So like medications, doctors will dispense it in 3-month increments because they want to check back in with you. They're really monitoring and controlling your care. So they're not going to dispense like a year's worth of therapy and just see what happens to you in a year. They want to follow along. So it's usually, try it for 3 months, see how it's going. If you find that it's just not for you, you're under no obligation to refill. But then it is an every 3-month refill process so that you reload the device for the following 3 months.
Yeah. So, like, I'm a chronic, but for those out there that are episodic, have you guys had data or stories about going ahead and using it preventatively, even when they're not in cycle, as to how that works or if that's helpful?
Data questions are for Nori.
Okay. So our preventative studies, because it's hard to predict an episode when you're episodic. So our studies for preventative are all mostly on chronic cluster because we know when they're gonna get an attack. So what you will see is for the acute, those are really from the episodic populations, and it's highly effective for episodic in an acute and abortive mode. So I don't have data to say, oh yeah, it's absolutely going to be as good as chronic. I would say there's no reason why you shouldn't try it in that regard. But yeah, unfortunately, the studies are included chronic cluster just because of the logistics of recruiting episodic individuals while they're in an episode.
That makes a lot of sense. So, Lisa, the next one's probably for you. Does insurance cover this device? Would you
Mhm.
like to kind of explain that a little bit?
Yes, I will. Unfortunately, insurance is not covering gammaCore for the most part. Unfortunately, they've been very slow to recognize non-drug options to treat
Yeah.
headache disease states, and we are consistently still working on it. But we do work with a specialty pharmacy where we can submit your prescription over to them and they can do a benefit review. But the majority of times it comes back that it's not covered, unfortunately. So you can also work with your insurance company and reach out to them ahead of time to find out if it is covered. So largely it is a cash pay program right now that's run through us, the manufacturer. And we do everything that we can to see if it would be covered, but if it's not, then it's typically a cash pay program.
And does the VA still cover it in part?
Yeah, in whole, actually. So if you're a veteran and you have you're seen by a doctor in the VA system, you certainly can have gammaCore ordered for you. The order will be placed by the doctor through their prosthetics department, and then a prosthetics agent will place the order with us and provide a credit card for payment. And then it gets shipped directly to the veteran's home.
That's awesome. I love that. At least the veterans are covered.
Veterans.
I hope we can keep advocating to get more insurances on board. It's a big
Yes.
thing. So, Nori, the next one is probably for you. So, I'm a nurse, and when we start IVs, people vagal down. Would this ever happen with the device?
So we do not see that with the device or syncope or things like that. And the reason for that is typically when people vagal down or having a vasovagal event, that is mediated by specific fibers in the vagus nerve called C fibers. Those C fibers have the highest electrical threshold out of all the fibers in the vagus nerve. So gammaCore was designed with this in mind. And so the maximum output of the device, so if you crank it all the way up to 40, like Lisa was talking about, that maximum output is still fourfold lower than the electrical threshold needed to activate those C fibers. So it should not induce a vasovagal event, even if you're going to crank it all the way up to 40 and use all your stimulations. Like, I don't recommend, but it should not cause somebody to vagal down or induce syncope. And you can even go to the FDA's device, adverse reporting, and we do not have any serious adverse events related to vasovagal events.
Thank you. Um, so if a person uses Imitrex injections and they're woken up in the middle of the night, like they're going to reach for that injection, can they still use gammaCore after they have injected Imitrex?
Absolutely. Yes.
Yes. Or I would even venture to say, use gammaCore first. And if you don't get an immediate response, then go to the Imatrix.
Yeah. Do you guys know if it's available in Australia yet?
I
Lisa.
believe that it is available in Australia. It may be limited, but we do have a distributor there. So I can find out more about that and make sure I get that answer to you, Anna.
Thank you.
If you can
Yeah,
distribute.
I know it's available in various countries. I just found out a couple of countries it's not available in yet. Some people were asking about it. So yeah, it does vary country to country. An aneurysm clip that is MRI safe, is that a contraindication?
No, it is not. Since it's an implanted device, yes, but it is not electrically active. So again, I think it's always great to talk to your physician and your provider about this and let them know that, you have this, it's a concern, you'd like to use gammaCore, but you just want to make sure that you guys are monitoring, oops, I can't say that. You're watching that together. But it's not a contraindication, just something to keep in mind and look out for.
Yeah, that's great because we do need to talk to our doctors, but sometimes our doctors don't know either. So it's always good to have you guys as a resource. And I know you you guys are open to those phone calls and from either the patient or the provider. So
I
I
was going to
appreciate
mention that if you have a provider that doesn't know about gammaCore, doesn't have a great understanding of it, they can go to our website, gammacore.com, just like you can. There's a Calendly link up in the top left corner, right corner, I believe. And there's an option to schedule a patient training, but there's also an option to schedule a provider training. So
that.
if there's a provider who would like to get on and have a conversation like this so that they are more well informed, we're happy to do that.
Are you guys able to say what the cost is for a 90 days or for a year right now?
No one told me not to, so I guess yes. So right now, and I'm, reserve the, I mean,
Today is
we
October
always have
7th.
to be able to say that it could change at any time.
Yes.
But currently, if you had a gammaCore prescribed for you today, the cost for 3 months of therapy is $600. The first 3 months, when you first get it, we will discount that to an introductory rate of $450. Just trying to give you guys a chance to try it for the 3 months, right? So if you get that device the very first time for you, it will be $450. And then every time you refill it later, it does go up to $600. Yeah, the
Thank you.
regular price.
I know that's a question everybody wants to know, and no, I appreciate you being able to answer it. So, talk us through as a patient, let's say I go to my neurologist and I say, "Hey, I just watched this webinar. I want to try gammaCore." How does that process work? I know you've talked about pieces of it, but can you just walk us through the steps?
Yeah, of course. So on our website again at gammacore.com, there's a prescriber tab or how to prescribe, and you click on that, or your prescriber can, and there's going to be a form that can be downloaded and completed. So there's it's called an enrollment form. It's really a prescription form. It acts as a prescription form. Your provider would complete that, and then there's instructions on the form. You can either email it or fax it into us to the number that's on the form. Once we receive it, my team will receive that by fax or email. We will then reach out to the patient, usually within a day or same day, if not next day. And we will go over the program with you. We'll let you know, what's involved, go over a lot of the information that we already went over today here on in this webinar. And then just give the patient the option if they'd like to go ahead and try it for 3 months, they can. We do keep prescriptions on file for up to a year. So if you need time to think about it, that's fine. You can always contact us back at a later date if you do decide to try it. But then, once payment is received, we confirm your shipping address. It is often processed that day, if not within a couple of days, depending on how busy the warehouse is. But it often goes out same day. Worst case scenario, it takes a couple of days. And then it arrives at your door. And by that time, we've called you and we've kind of made sure you have your tracking. We've tried to schedule you for a training. Again, you can opt to do that at any point in time. You don't have to do it before you start, but it is highly recommended. But we'll start walking with you all along the way.
I appreciate that. So there's a few questions and I'm going to wrap them into one. So there's a lot of people that would love to try it, right? They would like to at least just try it once to see, can they use it? What does it feel like? Would this be an option for them? Do you guys, are there providers who actually have gammaCore devices? Are you guys available out at any type of events? Are there options for people to try it?
Yeah, and that's a really good question too. There are some providers that do have kind of evaluation devices in office that are active. If you use our physician finder I guess the provider finder on our website, again, gammacore.com, I believe down at the bottom, there's a bar that says, find a physician, and you put in your zip code, and it will give you some options of providers who have opted to be there, who hopefully, would have that evaluation device. So I would call them ask them to find out, do they still indeed have a gammaCore that they would be able to, let you try. And that's one way to go. But then, yes, we are at some shows sometimes. And Nori, I think you have more information about the shows than I do.
Yes. I mean, so typically we'll be at the major headache shows like the American Headache Society. We'll be at a lot of functional wellness shows, but we typically have a wellness device there. So I'll be at one next week. So we don't really have those posted, but if people were really, interested, they could potentially reach out and find out where we're at.
And they're mostly providers, though, I guess, now that I'm realizing it. They're mostly provider shows, so it's not really patient focused. Going the doctor route's probably the best way to do the healthcare provider route.
Thank you. Does FSA, HSA cover this? So if I buy it, can I get reimbursed through FSA or HSA?
Yes, you can use your FSA or HSA card to purchase.
I think I have caught all the questions because there were a couple that came through that I think we answered along the way. If I missed anything, can you drop it back in the chat? I didn't mean to. But while we wait and see if anyone else has any final questions before we wrap up, I just really want to thank you guys for being here to share with our community. And just talk about how a device can play a role in us getting better management and having more options. I don't see any more questions coming in, so I just want to thank everybody for coming. And if you are watching this as a recording and you have any questions, please reach out to Clusterbusters. You can reach me at anna@clusterbusters.org. And if I cannot answer the question, then I will certainly pass it along to the electroCore gammaCore team and get you a response back. So I appreciate everyone being here. And thank you guys so much for joining us.
Our pleasure.
Thank you very much.
You're welcome.
And